Is Polycystic Ovarian Syndrome, PCOS Awareness Month. It's dedicated to raising awareness of a condition that is believed to affect up to 1 in 5 women. PCOS is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. Its further cause is, of course, rather not well understood, but it may involve a combination of genetic and environmental factors. Medical expert Karen Besser speaks to us now about this. Karen, good morning to you and thank you so much for your time. Quite an important conversation to have, particularly this month. Let's talk about PCOS. How prevalent is it amongst women in South Africa?
Well, statistics say that 1 in 5 women, 1 in 10 women will have PCOS. The unfortunate challenge is that the symptoms are sometimes not very well, or when you get the symptoms, you don't understand that it's PCOS, because you might find that you grow hair on your chin and you're not menstruating regularly, or you are picking up weight, but you're unable to have babies. So those symptoms aren't necessarily connected to each other. So women don't seek help, and they then most of the statistics that we do generate come from our infertility clinics, where we know that 50% of infertility is actually caused by PCOS or PCOS.
So how does then a woman know if they do have PCOS? Does it need a diagnosis? Are there any symptoms that can give an indication that you definitely need to get medical attention?
Well, there are multitudes of symptoms, but we really look at for 3 symptoms. The first one is that you have your menstruation the period between menstruations become longer. So if your menstruations are more than 35 days apart, or you menstruate less than 8 times a year in fertile age. So I just have to say, if you are supposed to have babies, that's what we're looking for. After 45, we probably think that you're going into perimenopause. So irregular menstruation or no menstruation. The second symptom is that we look for oily skin or male pattern hair growth, which indicates that you have more androgens in your blood, and that's because your ovaries are not working properly. The female fluctuation doesn't happen, and you then have raised androgens. And only the third diagnosis, or the third thing we look for, is that you are diagnosed with cysts on your ovaries, and that you would then pick up with your gynae. So it's 2 of those symptoms you can self-identify, and if you have 2 of the 3, then you have PCOS.
Yeah. Karen, is there treatment for PCOS?
There definitely is. We know that PCOS is, what we know for certain is that PCOS is linked to insulin resistance. And insulin resistance is very manageable. So at the company that I work for, we work specifically with a very natural ingredient called myo-inositol, which it's a plant-based extract that literally helps with this insulin resistance, and then can normalize the hormonal fluctuations once again. And we see that women start to menstruate, their fertility improves, and of course the other signs and symptoms, weight gain, hair growth, acne, oily skin, all of those also improve. So it is very manageable. It is about that we want to pick it up as quickly as possible, and that's why we love PCOS Education Month. We really do focus very much on September, because we think that if more women are noticing that they have the symptoms, and they do arrive and they are treated earlier, then we don't struggle with the complications that we have.
Yeah.
And of course, insulin resistance can one of the biggest complications would be diabetes.
Right.
And we can pick it up very young. So if you've started menstruating, we generally give you 6 months to get into a routine. And if after 6 months you're not in that routine, we start investigating.
So for a woman right now who perhaps has listened to this conversation and is wondering, because we're talking about treatment and how to manage PCOS, can it get chronic? Is it a chronic disorder? And can it be cured? It is.
It's a chronic disorder. We treat the symptoms. So we don't know yet if it can be cured, because we don't understand if it's genetically driven or if it's purely environment. But there's more and more research, there's more and more education. There are multitudes of companies that are looking at, or medical doctors that are looking at this disease, because of the fact that it's such a high incidence, in especially when we see it in the fertility clinics. So there's a lot of research that's being done to prevent it. Or to pick it up as quickly as possible, treat the symptoms that you do have, and try and manage it as best you can.
Yeah. So what's your advice right now, just to anyone who may suspect that they may have symptoms related to PCOS at whatever age? Because it seems like it's not only for elderly women. It can happen at, in your teens or when you're a young woman. So at any age, this is something definitely to pay attention to as a woman.
Yeah, so we're looking at 11 to 45-year-olds, females. And I would suggest that you see your GP, see a medical professional that you have contact with. So it could be a GP, it could be a gynae, endocrinologists are also doctors that are that probably are the biggest treaters of PCOS. If you have the symptoms, rather start treating early. And for instance, for me as a mom with daughters, I would love for my kids to have grandchildren when they get to that point, So you don't want them to go through the struggle of infertility. And I really do think as a mom, it's a good idea to make sure that your daughter is menstruating regularly,
Yeah.
and that he doesn't have, because also the challenges with acne and weight gain are emotional. It is an emotional roller coaster. Some people I've spoken to have been diagnosed, it's life impairing. I'm never going to be able to have children. That's not the truth any longer.
Right.
It's definitely treatable. And it is just acknowledging the fact that you do have it and that we need to look after you better.
Yeah.
So many medical professionals out there are able to treat this and manage
And
it.
I definitely agree with you. As a mom to, a daughter, this is the perfect time to start having that conversation with your girls as well. So they get educated, they know what's going on, and you also monitor, of course, their bodies and what happens. But thank you so much. Medical expert Karen Bester, thank you for this conversation. PCOS is definitely, a disorder that is treatable. If you do have those symptoms as a woman, if you know that your daughter may be going through something and is between 11, or you know of anyone even between 11 and 45 that needs this information, make sure that you do get medical attention and consult with your medical doctor.